Hello, and thank you so much for tuning in today. Today, we are going to be discussing hidden symptoms of MS that people often miss. And by people, what I mean is neurologists as well as someone with MS. These are symptoms that often appear before having MS, but we miss them and we don't realize them, or they are misattributed to other causes. There are three main categories of these hidden symptoms that we're going to be discussing today. The first is cognitive changes. The second is autonomic nervous system changes and disruptions. And then the third is neurologically based mood alterations. And again, these can appear years before a diagnosis, but I do just want to state a little disclaimer here. Having these symptoms that we're going to be talking about today does not mean that you have MS. If you are someone who's listening and you're not diagnosed with MS, or maybe you have a different diagnosis, this doesn't mean that you have MS. These are common in many conditions and sometimes occur in perfectly healthy individuals. What makes these symptoms potentially significant for MS is their pattern, their combination, and their behavior over time, not just their mere presence or existence. These symptoms do warrant medical attention if they persist or interfere with your daily life. But remember that most people with these symptoms don't have MS. The purpose of discussing these lesser known hidden symptoms isn't to cause worry, but to empower people to have informed conversations with their healthcare providers. Everything we're going to be talking about today and all these symptoms that we're going to be mentioning have come from conversations with my clients. So they are anecdotal, what my clients realize now looking back, some symptoms that they had without even realizing it prior to their diagnosis. But this information is also backed by research. There is so much research in recent years, anywhere from now until 10 years ago, that show these subtle hidden changes that could appear 5 or more years before diagnosis. So it's that combination of anecdotes, but also actual research and science backing this up. So, we are first going to touch on the cognitive changes that you might be experiencing. One of the most common and most discussed cognitive changes is brain fog. And this can feel different for everyone experiencing it. But generally speaking, from what my patients and clients share, is that brain fog can just be forgetfulness, confusion, forgetting where you were, what you were supposed to be doing, just this general fog, and it interrupts their daily life. And many patients report brain fog specifically prior to being diagnosed with MS. Other ways that my patients and clients have described brain fog is difficulty multitasking, losing their train of thought mid sentence, and trouble finding words. And oftentimes, something like brain fog is attributed to stress or sleep deprivation or getting older, which is one reason why brain fog alone often doesn't lead to any type of diagnosis, especially not something like MS. But we're going to dive into 5 categories of cognitive changes, and I want to explain a bit about what types of symptoms or what types of things you'd be experiencing for each of these 5 categories. So the first category is short-term memory lapse. The second is information processing struggles. The third is executive function challenges. The fourth is attention deficits. And the fifth is language difficulties. So I'm going to go back through each of those and give you some examples of what each one might include. So for short-term memory lapse, this is the one that probably most of us can understand right away. But this would be symptoms like forgetting why you entered a room, losing items more frequently, difficulty remembering recent conversations, and forgetting appointments despite reminder symptoms. I have had several patients with short term memory lapses, and one in particular, we were working on reminder systems in place to have at home. And she had a whiteboard where she would write down all of her appointments, what they were, what times they were at, where the address and where she was supposed to go. We also had alarms in her phone that would go off at a specific time for her to get ready for the appointment. And we implemented lots of different strategies to remind her about these appointments, yet she would often forget them, even with those things in place. So that is an example of short-term memory lapse. Moving on to the second, which was information processing. So these would be symptoms such as reading the same paragraph multiple times because you are having difficulty understanding and processing what it is that you're reading. It could be a research paper, it could be something for fun, it could be directions, it could be a text message, it could be anything. Another example of information processing would be difficulty following complex TV plots from television or even a movie, taking longer to respond in conversations, and also trouble comprehending written instructions, which kind of goes back to that first one of having to read things multiple times due to difficulty comprehending these words that are in front of you. The next is executive function challenges. So, executive function is what we use on a daily basis to carry out tasks. And it's funny thinking of this right now. Funny is not the right word, but it's interesting because my daughter just turned 1 and I have this app where it tells you what leaps she's going through. And each leap is when she and other babies her age are learning a specific thing. And so last month, the leap that she went through was, I believe it was called sequences, where she can understand that a sequence might be grabbing a toothbrush, followed by putting it underwater, followed by putting toothpaste on, followed by putting it in your mouth. So she was understanding those sequences. Whereas this month, the leap that she's going through is programs, which is basically your ability to associate that entire sequence that we just discussed, those 4 steps or so, as brushing your teeth. And it's just so interesting. Most of us, and I would actually say all of us, don't remember going through these leaps, but there was a time where we didn't know how to put all these things together. We weren't able to plan multiple steps for something or understand what the steps were. So it's just interesting as was reviewing my notes for this episode, this specific category of executive function is currently what my daughter is going through, but we can also experience difficulties and challenges in this area when MS is involved. So some examples are inability to plan multi-step tasks like brushing your teeth or even getting dressed. Those are multiple steps. You need to know what clothes to put on and what are you going to put on first? What are you going to put on second? Showering is another example. You have to get in the shower and then what steps are you going to take? What are you going to do first? And what does that thing require? If you decide you're going to shampoo your hair first, you need to know to grab the shampoo bottle, not the conditioner bottle or the body wash. So, planning these multi step tasks is an executive function. Another example would be difficulty prioritizing daily tasks or daily activities. This could just be activities for yourself of what do you need to do today. If you have children or grandchildren, it could be difficulty prioritizing their activities. Another example is problems with organizing your personal spaces. This is a tricky one because some of us, like myself included, we have difficulty with this anyways, but this takes it to another level. It's not just that, oh, we just keep putting it on the back burner. It's more so that we can't understand how to organize my personal space. Where does everything go? How do I even make this space cleaner and feel better? Another example is making more errors in your routine tasks. And this is the one that I hear most often from my patients with MS, decision fatigue, and just feeling overwhelmed by simple choices or what should be simple choices, but it doesn't feel that way. So, decision fatigue. With MS, fatigue in general is one of the most common symptoms that people with MS experience. And fatigue isn't just physical, it's also mental. And this is the part of that mental fatigue that might be kicking in for you. And it's under that executive function category. The next is attention deficits. This one kind of self explanatory, unable to focus in environments with minimal distractions, losing your focus mid task or mid conversation, and difficulty maintaining attention during conversations, and mental exhaustion after short periods of concentration. Again, a lot of people can have attention deficits. So, just a reminder, if you have these, it doesn't mean that you have MS, but it can be a symptom of MS, especially pre diagnosis. And the last one under these cognitive changes or cognitive symptoms category is language difficulties. So this is something like word finding challenges, like tip of the tongue phenomenon. Like it's on the tip of my tongue, but what is it? I can't think of it. Even if it's something that you feel like you should know, maybe it's your spouse's first name. It could be something like that. Or it could be something that was a memory from a few years ago. Either way, difficulty finding the word that you're looking for. Substituting incorrect words without noticing is another language difficulty, and difficulty understanding complex verbal instructions. So, all of these are examples of what possibly could be this subtle cognitive change, this hidden symptom that could possibly mean that you have multiple sclerosis. Again, there's lots of other conditions, and even people who don't have a condition can have a lot of these, but just something to keep in mind. And as you're listening to this episode, thinking back, thinking a few years prior to your diagnosis, did you have any of these? But also, just a reminder, not everyone with MS, even after diagnosis, will have cognitive changes. So, again, just throwing that out there. Just wanted you to be aware. Okay, the second category of these hidden symptoms is autonomic nervous system. And there's, again, research showing specifically that autonomic dysfunction in early MS often preceded the diagnosis. And I think a lot of you listening who have MS might find that you have several of these. So, similar to our last category of cognitive changes, the autonomic nervous system symptoms also has 5 categories that we're going to review. The first, and I feel like this needs a drum roll. The first one is so common. It's temperature regulation issues, but it's not just heat intolerance. It's more than that. The second is cardiovascular irregularities. The third is digestive system disruptions. The fourth is sleep disturbances. And the fifth is just some other autonomic disruptions that I wanted to include. So, temperature regulation issues. Of course, this could mean heat sensitivity or heat intolerance, also called Otoff's phenomenon. And that is when your core temperature rises by at least half of a degree, and it causes any of your current symptoms to worsen. But it's not just that. Temperature regulation issues could also mean that you have one sided body temperature differences. If you feel like one side of your body is hotter or colder than the other side, that is an autonomic nervous system symptom. Another one is excessive sweating that is unrelated to activity or environment. Another is persistent cold hands and feet, regardless of your environment. And then the last one is exaggerated response to minor temperature changes. I have tons of missing link members that have one, if not several, of these conditions. And just a throwback memory for you, I remember back in around 2018 or 2019, I partnered with the MS Society and I was leading a keynote speech at one of their events. And someone stood up, it was a man, and he was speaking on behalf of his wife, who was sitting right next to him. And he specifically asked me that it was chilly in the room that we were in. And he said his wife, sitting next to him, has MS and she was sweating. And he was asking why this is happening. And he also then further explained that the opposite could happen. It could be hot outside and everyone else is sweating and she is shivering. So those are examples of autonomic nervous system symptoms related to temperature regulation, or as I like to call them, temperature misregulation or dysregulation. The next subcategory under autonomic nervous system symptoms is cardiovascular irregularities. This might be unexplained racing heart, especially when you're resting, blood pressure fluctuations that are unrelated to activity, sensation of heart palpitations without cardiac cause, and exercise intolerance disproportionate to your fitness levels or disproportionate to what your symptoms are. If you have weakness from MS or muscle tightness or difficulty balancing, etc. The next subcategory is digestive system disruptions. This one I find so interesting because I have had a handful of patients who had to stop their physical therapy with me due to digestive system disruptions. And oftentimes, if we're having digestive symptoms, or even the previous subcategory, cardiovascular irregularities, if something is happening in those specific realms, we don't assume that it's MS related or our autonomic nervous system related. We just assume maybe I have IBS, maybe I am stressed, maybe XYZ. But autonomic nervous system changes, irregularities can cause these things. So, digestive system disruption examples would be intermittent dysphagia. Dysphagia is difficulty swallowing, unexplained nausea that comes and goes rapidly, bowel urgency without infection or a dietary cause, and alternating between constipation and diarrhea without an IBS diagnosis. Another one that I want to insert here is it kind of goes along with the unexplained nausea that comes and goes. But I had one of my patients with MS many, many years ago, and she had this unexplained nausea that comes and goes, but it was to the point where she couldn't eat anything. Her nausea started anytime she started to eat. And so she had to immediately stop. And it eventually led to a lot of pain as well in her GI system, in her stomach. And so that is another thing that might be occurring if you have digestive system disruptions. This is definitely something to talk to your neurologist about. This is not just because you have IBS. It's not just because you're stressed or because you ate fried food. This is specifically due to a change in your nervous system. Therefore, it's going to require a different treatment or management approach. Another category or subcategory within the autonomic nervous system symptoms is sleep disturbances. Now, sleep disturbances can happen for so many reasons when it comes to MS, but this category in particular would be examples like fragmented sleep despite proper sleep hygiene, excessive daytime sleepiness despite adequate sleep duration, vivid or disturbing dreams preceding neurological symptoms, and sudden onset insomnia resistant to usual treatments. There are other reasons for sleep disturbances when it comes to MS, like if you have urinary incontinence or urgency or frequency and you're just constantly waking up because you need to go to the bathroom, that would be a sleep disturbance, but it's not related to the autonomic nervous system. With that said, I think this is a great segue. My fifth category was the other other autonomic disruptions, and that would be bladder urgency without infection. So there's lots of patients that I work with and missing link members who have bladder urgency and incontinence. And sometimes there's a reason for it. It's that they have a urinary tract infection or some other type of infection. But it is possible to have bladder changes unrelated to an infection or unrelated to the way that you are eating or if you're staying hydrated or not. And instead, it's due to the autonomic nervous system. So it is important if you are having bladder symptoms and bowel symptoms for that matter, it is important to mention these to your neurologist and have a brainstorming session to try to figure out why it might be happening. Is it an infection or, again, your diet, if you're staying hydrated or not, all these other things? Or is it your autonomic nervous system? They will lead to drastically different types of treatment and management approaches. Other autonomic nervous system symptoms could be things like sexual dysfunction without hormonal or psychological cause, postural orthostatic tachycardia, which is also known as POTS, so POTS like symptoms, and pupillary light reflex changes, so vision changes. Okay, the third category that I want to make you aware of is mood alterations as neurological symptoms. And again, there is research backing this up, stating that this specific category of mood alterations can precede an MS diagnosis by several years. Neuroinflammation directly affects mood regulation. And there is a difference between situational depression and neurologically based depression or mood changes. And I think it's so important to understand that the changes that occur in your brain due to MS can cause depression, anxiety, mood changes. It's not necessarily that you're dealing with MS or that you have a stressful situation going on. It physically changes your brain to make you feel depressed or to make you have this mood change, mood alteration. And again, I just think it's so important to differentiate that because so often, if you feel depressed and you have MS, we might assume, or maybe even your doctors will just say, oh, well, of course you're depressed, you have MS. That's a depressing thing for you to experience. And it can be that, but it also could not be that. So let's dive more into what other mood alterations you might be experiencing pre-MS or even now that you are diagnosed with MS. If you don't know this about me yet, I'm a big list person. So for mood alterations, I also have 5 categories with examples for each one. So the first category is neurologically based mood changes. The second is anxiety manifestations. The third is depression characteristics. The fourth is personality changes. And the fifth is correlation patterns. So let's first touch on neurologically based mood changes. These would be things like sudden, unexplained emotional lability, like rapid mood swings, crying easily without feeling sad, inappropriate laughing or emotional responses, apathy toward previously enjoyed activities, and irritability disproportionate to situations. I think it's so important to talk about this because it's not super common, but for the people who are experiencing it, and I've had several patients experience this, they think they're crazy or their family members think they're crazy. Like, what is happening? Why am I crying? I'm happy right now, or I'm not sad, yet I'm crying uncontrollably, or I'm laughing and it's a very serious situation or just a normal situation. And it's just these emotions that are not appropriate for the specific time that you are in. This can also be called the pseudo-bulbar effect, and it is a mood alteration due to the changes in your brain from MS. The next is anxiety manifestations, which would be things like physical anxiety symptoms without psychological triggers, anxiety that follows patterns of neurological symptoms, panic-like episode with neurological overlay like numbness or tingling, and generalized anxiety resistant to typical psychological interventions. So it's not necessarily the same as the type of anxiety someone would experience unrelated to MS. There is a little bit of carryover there, but the main differentiator is that it's following this pattern of neurological symptoms, or it's resistant to psychological interventions that you may have tried and had worked on successfully in the past. Depression characteristics are things like morning depression that improves as the day progresses, depression with concurrent unexplained physical symptoms, brief episodes coinciding with other neurological symptoms, and treatment-resistant depression that improves with MS treatments. So again, a lot of people have depression, but this is different. This is not the same thing. This is due to the changes in our brain when MS is involved. Next up is personality changes. So this might be things like reduced emotional reactivity noticed by family, decreased empathy or emotional engagement, emerging rigidity in thinking or routines, and personality shifts that correlate with physical symptom cycles. The last, but definitely not the least, category is the correlation patterns. And this is going to sound so weird to say, but I love anytime we can correlate a symptom with a cause, because if we can treat the cause, more often than not, it's a quicker treatment. So the first example is mood symptoms that worsen with heat exposure. So mood symptoms could be anything that we've discussed thus far, but it's specifically worsened when your core temperature rises. And so the beautiful thing about this is, if this is true for you, we just need to keep your core temperature down. And then that symptom can pretty quickly dissipate. And just one thing I want to mention about heat exposure, and also when we were talking earlier about temperature misregulation, is that heat is not always the temperature outside. It absolutely can be, but it could also be stress. When we are stressed, our body produces more heat and our core temperature can rise. It could be a warm shower or a lukewarm shower or a hot shower, depending on your level of heat sensitivity. It could be exercise. Exercise builds up heat in our body. So if you are having any symptom, one of the first things I always tell my missing link members is, if you're having any worsened symptom, the first question to ask yourself is there the possibility that my core temperature might be rising by half of a degree, which is so little? If the answer is yes, do what you got to do to lower your core temperature. Sip ice cold water, put a cooling vest on or cooling wristbands, get in front of a fan, take some layers off, do what you got to do. And if that symptom improves, that's likely what it was. If it doesn't improve, then trial and error. We now know that didn't work. It might be something else. Another correlation pattern would be neuropsychiatric symptoms that cluster with physical symptom flares. Another is rapid onset or rapid resolution compared to typical psychiatric conditions, and symptoms responding differently to traditional psychiatric treatments. Because again, this is not the same thing as typical anxiety, typical depression, typical psychiatric changes and difficulties, symptoms, limitations, whatever you want to call it. It's due to the changes in our brain. Okay, I feel like we should all take a deep breath. That was a lot. And again, I just want to reiterate that just because you might be experiencing one of these symptoms does not mean that you have multiple sclerosis. But if you are experiencing these symptoms, or if you were pre-diagnosis, I just want you to feel validated and seen. These are real symptoms of MS, and you are not crazy, or you weren't going crazy. This is something that people do experience. These symptoms that we mentioned might sound like unusual MS symptoms or weird symptoms of MS and MS symptoms that nobody talks about, but it doesn't mean they're not happening. Symptoms alone are never enough for diagnosis. Even neurologists use comprehensive testing, including MRIs, spinal fluid analysis, and clinical exams to diagnose MS. You would never be diagnosed with MS just because you have one or even several of the symptoms that we talked about today. The key differentiator is often how these symptoms cluster together, if they come and go, or respond to environmental factors like heat. Everything that we discussed today is meant to educate you and not diagnose you. Of course, only qualified healthcare professionals and providers can determine if these symptoms would require further investigation and possible treatment or management. But just know that if you're experiencing any of these, you're not going crazy. This is valid. And mention it to your healthcare providers. You never know what is possible in terms of helping you feel your best unless we talk about it. And even if you're only experiencing one or two of these, if you mention them to your doctors and they realize, okay, this is a cluster and they're able to put these correlations together, there might be something that can help and you don't have to suffer in silence. I hope you found this helpful. If you are looking for a community of people that gets it, I cannot recommend the community that comes with my online membership, the missing link, enough. Anytime I talk about the community, I just, my face gets a big smile and my heart just feels so happy and warm and joyful. It truly feels, when you log into that group, it feels like you're getting a big hug and it feels like a sigh of relief, like people get it. And this community has been up and running for about a little over 6 years now. And the reason that I love that is because so many conversations have been had in there on a lot of these symptoms that we just talked about today. And if you just use the search bar to search for the symptom or a question, you will find tons of information from our members on what they were experiencing, what they found to help them, and just words of wisdom that can help you feel seen and heard. So that community does come with our membership. And of course, the membership is also highly focused around exercises to help you improve your strength, your balance, your walking, making your daily activities feel easier. So that's a big component as well. But if you need that community, if you want to be surrounded by people who get it, definitely check out the missing link. I'll put the description and link for you to learn more about it and see if it's a good fit for you in the show notes. Thanks so much for tuning in. Have a great day.